Chapter 31 Immunologic System Introduction. Anatomic structures and components of the immune system are composed of the bone marrow, the stem cells, the white blood cells, cytokines, eicosanoids, thymus, the lymphatics, and lymph nodes, liver, spleen, and the Peyer's patch. Let's go back to anatomy and physiology. When you're talking about immune system, you would automatically think about white blood cell, bone marrow, the thymus, the lymph, spleen, right? Those structures are like the core of immune system. So let's go over each of them one at a time. Bone marrow is the first one. What is the bone marrow? For example, this is the bone, right? Maybe a long bone, okay? For example, is the femur. The bone marrow is the spongy center of the bones, of the long bones, right? It's the spongy center of the bones. And the function of this bone marrow or this spongy center is this is the house, or this is where the white blood cells are made. In adults, the majority of these white blood cells are being produced in the vertebrae, in the ribs, the sternum, the skull, the pelvis, and the long bones of the legs. Okay, what about stem cells? So stem cells are called progenitor cells or precursor cells because they are capable of developing into various white blood cells, red blood cells, or platelets. If you look at figure 31.1 and page 554, you're going to see in there, so this one takes place in the bone marrow. And this is a figure that is actually showing us the maturation of cells. So it starts with a stem cell. So from that stem cell, it could actually go into either the lymphoid progenitor or the myeloerythroid progenitor, which actually becomes that reticulocyte, erythrocyte, and then the megakaryocyte that becomes the platelets, and so on and so forth. So for the right side, if you look at it, the lymphoid progenitor, that one becomes or could be the prolymphocyte, the B cell and the T cell and the plasma cell. The myeloid progenitor becomes the basophil, the eosinophil, and the mast cell. But the main point is, in this picture, it's showing us that stem cells, that's why it's called progenitor cells or precursor cells, because these cells are capable into developing as the various like white blood cells or red blood cells or platelets. So where are the stem cells or the majority of the stem cells located at? Well, majority of our stem cells are actually located in the bone marrow. Okay, the bone marrow that we just talked about. Some stem cells, yes, they do circulate in the blood. I want to skip white blood cell or the leukocyte right now because we're gonna go more in depth uh, about it in the next PowerPoint. All right, so what's next? Let me actually get rid of this for now so we actually have some space. Okay. What about cytokines, right? What is cytokines? Well, cytokines in page 554, if you want to follow me, cytokines are hormones that are secreted by cells to signal other cells, okay? Cytokines are those hormones that are secreted by cells, and they're like the signal cells. They signal other cells. Some of the examples of our cytokines, your interferon, interleukin, your TNF, if you remember them from anatomy and physiology, granulocyte, your macrophage colony stimulating factor, granulocyte colony stimulating factor, and your erythropoietin or your EPO. We'll talk about that in a little bit. Okay, how about eicosanoids? What are they? They are fatty acids that regulate blood vessel vasodilation, temperature elevation, activation of your white blood cells, and other physiologic processes that's involved in immunity. The thymus. So what is the deal with the thymus? The thymus is an organ. It's a lymphoid organ, and this one is located in the upper chest below the thyroid. Okay. Here's what's going on with the thymus. Early in life, those white blood cells, we call them lymphocytes. Okay, for example, hold on. Okay, this is the thymus, right? We're gonna pretend, I don't know why it's yellow, but this is the thymus, okay? And this is located in the upper chest below your thyroid. So what happens is that in early life, before puberty, your white blood cells, or we call it lymphocytes, okay, lymphocytes, sorry for the handwriting, okay, they are actually being produced in the bone marrow like we did talk about. And then they migrate. So from here, right, in your bone marrow, right, and this is the spongy center, that's the bone marrow. This is where those lymphocytes are being produced, right? Those lymphocytes are being produced here, the white blood cell. What they do is they migrate into the thymus, and in the thymus, this is where they actually mature into what we call a T lymphocytes, or we call it also T cells. Okay, now after puberty, those T cells right here, okay, those T cells are being maximized, meaning you have enough T cells already. Okay, so because of that, your thymus doesn't have any functions anymore, right? So the thymus now is going to stop growing, and then eventually is going to shrink because the body no longer need it. Okay, no longer needed because there's enough mature T cells already. Okay, okay, now let's talk about lymphatics, and the lymph nodes. Let me take that out. The lymphatic has a number of functions. One of them is that if you recall, when that blood flow is actually flowing through the body, delivering those oxygen and then picking up that carbon dioxide, not all those plasma in that blood actually returns to the veins to be recirculated. What happens is that some of those plasma actually are being left behind in the tissues, and the lymphatic system is actually helping us. A lymphatic system is the network that is actually separated from the blood circulation system. And that lymphatic system is what collects those leftover plasma, those plasma that got left behind in the tissues. And then what it does is it returns it to the venous system. Another function of the lymphatic, those white blood cells that is actually going through the tissues and the organs, they're trying to, like, monitoring for infection, they go back to the circulation via the lymphatic system. There's a picture in page 556, figure 31.2. This one is a beautiful diagram of the lymphatic system. So you could see that it's like all over your body too, just like that blood circulation system. It's just that it's actually separated. It's a different system than the blood circulation system. Okay. Okay. Now lymph nodes. If you look at that picture in figure 31.2, those little dots, those little circles in there, those are what we call the lymph nodes. They are like small patches of lymphatic tissue, and they're all over the lymphatic system. And the function of the lymph nodes is to filter microorganisms from that lymphatic system before it is returned to the bloodstream. So this is the filter. That is why it makes sense when there's some kind of infection, those lymph nodes will actually become swollen because they were actually able to catch whatever pathogen it is that got inside the body. So that's why those lymph nodes get swollen. Also, some cancers will actually cause for lymph nodes to become swollen because, again, that's like a foreign thing that is actually inside the body. And the lymphatic system was able to filter it, or actually at least try to like contain it. Okay, the liver. What is the function of the liver with regards to the immune system? The liver is the one that filters the microorganisms from the blood using what we call the macrophage. Macrophage, if you recall, this is a type of white blood cell, and what they do is they do phagocytosis, right? Phagocytosis. What it does is it catches whatever pathogen it is and it kind of like engulfs it and destroy it. Okay, let me erase this again so we have a space. Okay, the spleen. What is the function of the spleen? The spleen is number one located in the upper left quadrant of the abdomen, and this spleen actually filters microorganisms also from the blood. In the spleen, there would be some white blood cell that's actually in there. And what it does is once it traps that microorganisms in the spleen, it's actually able to destroy that microorganism. Okay, pair patch. Pair patch are also a lymphoid tissue, and this one is found in the small intestine and some in the large intestine. And what it does is it actually has those some of those macrophages that we just did talk about that does the phagocytosis, and it also houses some of the B lymphocytes and the T lymphocytes. Okay, so while we're here talking about the structures that's important for the immune system, think about it. For example, your bone marrow or the lymph nodes or the spleen, right? They're helping to fight infections, try to catch it as early as we can. Some of them even have those macrophages that will actually be able to engulf the pathogen and destroy it before it can even cause infection in the body. So what if the spleen gets damaged, for example, after an accident? So the spleen, yes, you can function without a spleen, you can live without a spleen, but imagine what it will do to the person if we remove the spleen, then that intact immune system will be affected and there will be at high risk for infections. So if you have patients that had their spleen removed for some reason or some lymph nodes removed, then the nursing diagnosis that you're actually focusing on are risk for infection, right? Risk for injury, risk for infection. White blood cells or the leukocytes. So you can never talk about immune system without actually thinking about white blood cell, right? White blood cell plays a big part in immune system. Okay, the bone marrow is the one that produces your white blood cell, like we said, and the white blood cell have five major types, okay? Neutrophils is one, monocytes, eosinophils, basophils, and lymphocytes. So those major types of white blood cells, each of them have their own function. Each of them have their that own specific type of organism that they're trying to combat. And we'll go over them one at a time. Okay, so start with monocytes. Okay, monocytes, this one. From the bone marrow, let's try it again so we can visualize it. Right, this is the long bone. Very ugly long bone. And then the bone marrow is the spongy center, and then you have that white blood cell. While in here, we call it monocyte. Okay, monocyte. This one right here. Now, once it's released from the bone marrow into the blood circulation, now we call it macrophage. Okay, and again, macrophage are the ones that is actually able to ingest those pathogens or antigens and actually destroy them by the process of phagocytosis. Okay. Okay, the eosinophils is the white blood cell that is actually responsible for parasitic, allergic, and inflammatory reactions. And what it means is that, for example, you have a patient that is allergic to, let's say, peanuts, started eating it, or you're trying to rule out an allergic reaction, maybe a medication that is given to the patient, and at the time you didn't know or they don't know that they're allergic to that drug. What we can do is we can actually order a complete blood count like your CBC and check if the white blood cell is actually elevated, and if you're gonna see that the eosinophils is actually elevated, then that could be an allergic reaction. Same thing if you're trying to rule out some kind of inflammatory reactions in the body. If you want to rule that out, then you're going to order CBC, check for eosinophils. Obviously, if it's elevated, then there's some allergic reaction and inflammatory reactions that's going on. Okay, basophils. This one works with IgE, your immunoglobulin E, and basophils triggers the release of histamines, which is a potent vasodilator, if you can remember it. And that vasodilator is actually helping the white blood cell that is in the area of inflammation or infection to actually kind of like bring more white blood cells into the area, kind of like calling for help, right? Think of it as like a soldier that actually saw an enemy, and what it does is it actually vasodilates and it opens that gate so that she can call, or they can call, more basophils, more white blood cells to come and help them in the battle with the enemy, right? That's the metaphor I can think of. Okay, B lymphocytes, oh sorry, mast cells. Mast cells also is kind of like the basophils. What it does is it triggers the release of the histamines. Um, but this one for mast cells, they are actually the ones that are usually located in the tissues. Okay, basophils is more of in the blood circulation, while the mast cells is actually the one that is more in the tissues. Okay, B lymphocytes. Let me remove this so we can draw some in here. Okay. For the B lymphocytes, this is the one that's responsible for what we call the immunoglobulin, the IG. We call it IG. So let's draw it. For example, let's say that this is an antigen, right? Sorry about that. This is the antigen. And the B cell, or the B lymphocyte, B cell is going to kind of like see that antigen, right? This antigen, this is the antigen. And what it does is it's going to kind of like bind into that antigen. And after that, the B cell now, once it binds to the antigen, it's going to now produce what we call plasma cells, plasma, and B cell, memory B cells to be specific, okay? Memory B cells, okay? And what are those two things? Well, the plasma cells is the one that's now going to produce all those more immunoglobulins, more IgEs. It's going to increase the Ig so that it can actually fight the infection. Your memory B cells now is going to go in a resting state. Okay, what it does is it's going to be a resting state, but if the next time, that's why we call it memory B cells, the next time that the body gets exposed to this specific antigen again, right? The next time, the B cells is now, or memory B cells is now going to be reactivated, and it can quickly produce those plasma cells, and then it can actually make all those immunoglobulins again, those antibodies that is actually going to destroy the same antigen that we were exposed to the first time. Okay. T lymphocytes, or the T cells, there are two major types of T lymphocytes. You have TH, which is the TH, which is the T helper, and the TC, which is the T cytotoxic. Okay, what are the difference between the two? T helper is the one that actually secretes cytokines that activate other components of the immune system. We did talk about cytokines earlier on. These are the hormones that is secreted by the cells, right, to signal other cells, kind of like asking them for help. That's why it's called T helper. Okay, this is the one that's actually secreting the cytokines. Cytokines is the one that's calling for help, activating other components like your interleukin, interferon, and all of those things that we did talk about earlier. Okay, T helper is also called CD4 cells, right? And then we have TC, or T cytotoxic, or what we call this one, we call CD8 cells, and they are called CD4 and CD8 just because of the protein complex that is found in their, the membrane of the cell. But anyway, TH is called CD4 cells, and this is the helper cells, and TC, or T cytotoxic, is called CD8 cells, and this one actually can directly destroy foreign antigens. So if it sees an antigen, it's able to actually go over there and directly destroy it. Okay, instead of the T helper, or that's the difference between the two, is that T helper is actually the ones that's, alarming that signal. Cytokines will come, and then cytokines will alarm or signal, and then will ask more help. Cytotoxic, T cytotoxic is able to actually directly destroy the foreign antigens. That's the difference between the two T lymphocytes. Eicosanoids, we kind of like did talk about this. This is the fatty acids that regulate blood vessels, and it causes those vasodilation, again, to open up kind of like those gates so that more white blood cells can actually help us to combat the infection. Temperature elevation, this is to actually kind of like help destroy antigens too, because if the temperature is elevated, then they can actually kill some of those antigens. White blood cell activation and other physiologic processes that's involved in the immunity. Thymus, again, is a lymphoid organ in the upper chest below the thyroid. The lymphocytes actually gets produced in the bone marrow, and it migrate to the thymus, where they mature into T lymphocytes or T cells. And we did talk about those two types of your T cells and what they do to combat infection. Liver filter microorganisms from the blood so that macrophages can destroy them. Spleen also filters microorganisms from the blood. And again, just to kind of like emphasize this, splenectomy, which is the removal of spleen, puts the patient at risk for infection. And one thing to remember, patients should receive the vaccine for pneumonia, the pneumovax vaccine, so that they can form their own antibodies against pneumococcal bacteria before the patient will even go to do a splenectomy. If we can, right? If we can, we will give that pneumo vaccine before they will go into splenectomy and removal of the spleen, so that the patient can actually have that kind of um, immune system against pneumonia. Air patch, lymphoid tissue that's found in the small intestine where it transitions into the large intestine. And there's also some macrophage, B lymphocytes, and T lymphocytes. Physiologic functions of the immune system. So you have the innate immunity, acquired immunity, and the tolerance. Innate immunity means at birth, right? That's why it's called innate, at birth. This immunologic defense system are immediately functional, and they include those anatomic and physiologic barriers, inflammatory response, like we did talk about those cytokines and those tumor necrosis factor, those histamines, right? And the ability of the certain cells to actually do phagocytosis to engulf and destroy foreign invaders. And then you have what we call acquired immunity, acquired from the word itself. You're not born with it, it's something that you acquire, right? There are two types of acquired immunity. We call them antibody mediated, okay, antibody mediated, and cell mediated. Tolerance is the terminology that we use for immunologic response. This is when the immune system is able to actually recognize its own protein. And it's not attacking itself, right? Because it knows that it belongs to its own body, its own immune system. That's what we call tolerance. Now, those autoimmune diseases, when we talk about them, that is actually the time when the tolerance actually, there's a breakdown of tolerance of the immune system when autoimmune diseases actually occur. Again, innate immunity is at birth. This includes the skin and mucous membranes, sweat glands, the GI and the GU, your gastric juice, right? It's acid, um, the sweat, respiratory tracts, the normal flora, normal bacteria in the body, inflammation, your phagocytosis. Okay. Oh, and while we're here, let's talk about inflammation really quick. So what are those signs of your inflammation that we actually will see if there is actually an inflammation? There will be redness, right? Redness or rubor, we call it rubor, tumor or swelling, and then you will have heat, which is calor, and dolor or pain at the site of the injury of infection. So these four things, I highly recommend for you to remember them. Your inflammation, you will have redness, you will have swelling, heat, and pain. Okay, and then for your phagocytosis, you have the neutrophils, the monocytes, and the macrophages. Acquired immunity, from the word itself, it's acquired. We are not born with it. And there are two types of your acquired immunity: your cell mediated immunity and antibody mediated immunity. So again, your cell mediated immunity, this is your TC cells, your cytotoxic cells, that what it does is it recognizes the foreign antigens in cells, and then it secretes the cytotoxic substances, and it's able to destroy that defective cells, or it's able to destroy that antigen. For your antibody mediated immunity, you have the T helper cells and the memory B cells. So we kind of did touch base with the TH and the memory B cells earlier on. T helper cells is the one that gets activated first, and then what it does is it kind of like marks those antigen, and it's like tagging them so that those neutrophils and the monocytes and the macrophages are able to actually know that because of that tag, oh, this is an enemy, right? And then they're able to actually do phagocytosis and destroy the pathogen. For memory B cells, from the name itself, it's a memory. It stays there. It's like gets into that resting state, and the next time that we get, or the body gets exposed to that same pathogen, then it's going to be activated so that it can actually call those other cells, and that they can create more immunoglobulin or antibodies to actually help and combat that pathogen. All right, you have an active acquired and passive acquired. So under the acquired immunity, it could be active or it could be passive. So active meaning from exposure to the pathogen itself. You gotta be exposed to, for example, maybe a type of bacteria first, and then your body is actually going to create all those immunoglobulin, the antibodies, and so that the next time that you get actually exposed to that, you have that immunoglobulin. That is what we call active acquired, because you were exposed to the pathogen, you were exposed to that enemy, right, for the immune system to actually be activated. The passive acquired, from the word itself, passive, right, it's passing from one person to another. So it's produced by one person or animal, and then it gets transferred to another. Example of your passive acquired is the IgA antibodies in the immunoglobulin antibodies in mother's milk that actually gets passed into the baby via breastfeeding. Okay, age-related changes. Age-related changes, we can see it in box 31.1 in page 557. So number one, the bone marrow becomes less productive in older adults. Again, go back to the function of the bone marrow. The bone marrow is the area where those white blood cells are being produced. So if it becomes less productive, you will have less white blood cells, you will have an increased risk for infection. Then lymphatic tissue shrinks, resulting in fewer and smaller lymph nodes. Now, going back to the function of your lymph nodes, they are the ones in the lymphatic tissue and lymphatic system. They are the ones that's actually filtering pathogen from the body once it get inside and trying to prevent it from actually, spreading and create chaos. Immunologic function not affected unless a person is unusually stressed by trauma, a chronic infection, or treatment for cancer. All right, assessment. So you will start with the health history. You're gonna check if there's a persistent infection, do they bleed for a long time, or they get bruises easily, or has chronic fatigue, because that's when you would know if there is like a depletion of white blood cell or maybe platelets. And then if there's like signs and symptoms or they're actually complaining of something, then you're gonna ask for the onset, the severity, and if there is like precipitating or aggravating factors for the symptoms. Do they have illness or disorders, cancer, HIV, treatments, splenectomy? Those four things, if you could see, the common denominator is that they are at high risk for infection, right? Cancer and HIV, the immune system are really low. Treatments, there are some drugs that will actually deplete your white blood cell, decrease your immune system. For example, your corticosteroids, right? It actually will make your immune system go down. Splenectomy, I did explain this. If the spleen is removed, then there will be an increased risk for infection. Medications, including herbal products, family history, because if there is a family history, there's a good chance also that it could pass on to the kid or the patient. And then infections, signs and symptoms, occupations and hobbies, activity and exercise, sleep and rest, nutrition, coping and stress. Coping and stress, again, stress will actually make your immune system go down. And then when we continue with the physical examination, you're gonna first check the general survey of your patient, the mood, the expression, the responsiveness, and posture, because you will always know if there's something that's going on just by like doing a general survey of your patient. How quick is the response time of your patient? Is there a delay, right? Is there an altered mental status? Skin, the integrity of the skin, we gotta check. Head and neck, because we're looking for like swollen lymph nodes, um, enlarged tonsils, right? Sinuses, canker sores in the mouth, and then you have the thorax, um, because you're looking also for enlarged lymph nodes. Abdomen, because of the liver and the spleen, you want to see if there's like an enlargement of the liver and the spleen. Enlarged lymph nodes in the groin. Okay, and then we do diagnostic testing and procedure. I mentioned the CBC earlier on, which is a complete blood count. And what it does is it's going to show you red blood cells, hemoglobin, platelet, and then white blood cell would be in there, and then they will even show you in that test like your neutrophils, your monocytes, eosinophils, and all of those white blood cells that we did talk about. um HIV serologic and virologic test, because you're checking if there's an HIV, because like we said, HIV and cancer, they actually can suppress the immune system. Cultures of blood culture, we're checking if there's an infection that is actually going on or is circulating in the blood. Urine, you're trying to rule out UTI. Sputum, what about there's bacteria in the sputum that could actually cause the signs and symptoms of infection to your patient. Stool, right? Something that's going on in the GI. Maybe there's an inflammation that's going on in the GI. Skin tests also, allergic reactions. We did talk about those histamines and the vasodilations. So you're gonna check for skin, do a skin test to check if there's like some kind of allergic reactions. And that concludes chapter 31.